Thyroid, well, this has been an interesting one for me, done particularly at request. Otherwise, I might not have gone there, but I'm glad I did. So understanding thyroid function. And I'm just trying to get my technology to work. It works. Yeah. So as always, this is for information. It's not medical advice. I've used a few sources for this, but the main ones are Amy Berger, nutritionist in America, who has personal experience of thyroid dysfunction and has studied this in depth as well. Also, Brian Walsh, a naturopath, has a very good and detailed explanation of thyroid function in one of his actually in more than one of his YouTube videos. And also Dr. Ken Berry has given me some insight into this subject. So I'm going to go through how thyroid hormones are produced, what they do, and also signs and symptoms of hypothyroidism, which is not producing enough thyroid hormone, and hyper, which is an overactive thyroid. I'm going to be mentioning these two terms, hypothyroidism and hyperthyroidism, quite a few times. So if at any time it's unclear which one I'm referring to, try and let me know. Anyway, just to say it again, hypo is low, hyper is high. So how are thyroid hormones produced? Now, you've got to pay attention because it's going to be exam at the end of this.
Oh dear.
So I think it's worthwhile explaining how they're produced. Firstly, there's a thyroid, TRH, thyrotropin releasing hormone from the hypothalamus, which goes into the pituitary gland, which then produces TSH, thyroid stimulating hormone, which the thyroid takes in. So the hypothalamus and the pituitary gland are both in the brain, and the thyroid is located just in the sort of front of the neck, the lower part of the neck. So the thyroid produces T3, which is, I won't give it its full name, we just refer to it as T3 and T4, mostly T4, almost 93% T4. And once the thyroid has produced these, they're not initially active. They then send feedback to the hypothalamus and the pituitary gland, and it acts as a sort of like a thermostat in your home. It regulates. So if everything's working properly, you'll have the right amount of T3 being produced, and that will tell the pituitary gland to regulate how much TSH it produces. And then the T4 that is produced is converted, the bulk of it is converted into free T3, which is the active hormone that your cells need. Some of it is also converted into reverse T3. And if everything's working perfectly in your body, those will be converted in the right proportions that your body needs. So what do thyroid hormones do? Well, they regulate your body's metabolic rate, controlling the heart, muscle, digestive function, brain development, bone maintenance, and much more. Anything where metabolism occurs, essentially. It's like the free T3 is like the accelerator pedal on your body's metabolism. Too little and it goes too slow, and too much and it goes too fast. So let's have a quick look at signs and symptoms. I've taken these from Amy Berger's website. So firstly, weight gain or inability to lose weight. This is as a result of your basal metabolism slowing down, meaning you don't burn as many calories when at rest. Doing exercise isn't going to make up for this, especially when you have no energy to do exercise. So, and you can feel fatigue, depression, constipation, because your gut metabolism doesn't work at the correct rate. You can have cold hands and feet. You can just feel cold in general. You might have a slowed heart rate or low blood pressure. And you can guess that all these bodily functions, they're just your body slowing down a bit. And there's lots of other signs as well, hair loss and dry skin. And these are the symptoms of an overactive thyroid. So rapid heart rate and palpitations, increased appetite, and you can have weight loss with increased appetite as well. So you can be nervous and be anxious, get irritable, tremors in your hands as well, difficulty sleeping, and fatigue. Now, fatigue is the same symptom that occurs with low thyroid, but poor sleep can contribute to this as well. So that's why you can have the same symptoms with high and low.
That was quick.
And also, thyroid disease has been linked to diabetes, and diabetic patients who develop hyperthyroidism have higher risk of complications. So hyperthyroidism speeds up the rate that insulin is metabolized and increases the production and absorption of glucose. And this can lead to increased insulin resistance, which is problematic if you're diabetic. So let's just have a deeper look at this. Thyroid disease prevalence is surprisingly high among diabetics, 13% overall, but 31% in females with type 1. So this paper recommends that those with diabetes should be screened annually. And I know some of you are possibly already thinking, well, how do these percentages compare with the general population? This came out of Europe. 3% of the population have been diagnosed with hypothyroidism, but only 0.75% with the hyperthyroidism. But it means that those with diabetes are 3 to 4 times more likely to have thyroid disorders than those without. And this rises to over 8 times for women with type 1. But then there's other statistics. So just a small note of caution on these numbers, because I found different values in other sites, but they're all roughly in the same ballpark. Here, from this site, the Endocrine Web from the USA, says that hyperthyroidism affects 1.2% of the population, and 1% of those have Graves' disease, which is an autoimmune condition causing high levels of thyroid hormones. Other factors you can see are age, being a woman, and also after pregnancy. So let's look at some of the possible causes and risk factors for hypothyroidism, having low thyroid. Hashimoto's thyroiditis or disease seems to be the most common cause. Type 1 diabetes, celiac disease, pernicious anemia, rheumatoid arthritis. These are all autoimmune diseases that I've listed there, where the body's natural defense can't tell the difference between your own cells and foreign cells, causing the body to mistakenly attack normal cells. If you have one autoimmune disease, it's possible that you'll be at greater risk for others. So other causes of hypothyroidism can be an over-response to hyperthyroidism treatment. So they give you medication to slow down your thyroid, and thyroid surgery and radiation therapy can completely stop the production of thyroid hormones. And in that case, you have to take them yourself. But there's also other medications such as lithium, used for mood disorders, and amiodarone, which I know Brian was on, used to treat and prevent certain types of serious life-threatening ventricular arrhythmias. So just abnormal heart rhythms as well. So less common causes are your genes, congenital disease, pituitary disorders, and iodine deficiencies, which can happen. But also having a family history, and I keep going back to this, are older than 60, and especially in women. So just moving on to the last part on testing and diagnosis. I thought this statement from the National Institute of Health in America was telling. The number of people who have Hashimoto's disease in the United States is unknown. However, the disease is the most common cause of hypothyroidism. Remember a few slide backs, I gave a note of caution on the prevalence numbers. Well, this statement says they actually don't know. And it may be because either the tests are neither sufficient nor adequate. So what can go wrong? Going back to my diagram to see where things can go wrong. Your doctor is going to test your TSH, and he will also possibly test the T4 as well. But if things are going wrong elsewhere, just knowing your TSH and your T4 doesn't give you the full picture. It's been said to me that some doctors only test TSH, and that was described to me as knowing how many goals were scored in a football game, but not knowing who scored them and who won. So the next place where things can go wrong is for the thyroid to either under or overproduce, even if the TSH is in normal range. And then the T4 needs to be converted into free T3. And if that's not working properly, and there are instances where that doesn't work properly, then you can have low free T3. And finally, if your free T3 isn't being received within the cell properly, that can also be a problem. There are receptors in cells which take in the free T3. So let's quick look at testing. This is Dr. Ken Berry, and these are the tests that he recommends. Now, the TSH and the free T3, which are in bold blue font there, are the ones that the NHS routinely offer. Free T3 and reverse T3 tests are not routinely offered. He says they should be. And less commonly, the NHS may recommend thyroid antibody tests, which are in the red font, after a TSH and T4 test. This is to help diagnose or rule out autoimmune thyroid conditions, such as Hashimoto's or Graves'. But since Hashimoto's and Graves' disease, Graves' affects high thyroid hormone. Getting mixed up here. But they're both autoimmune conditions. and they're common amongst those with thyroid disorders. So including antibody tests, such as Dr. Berry says, seems to make a lot of sense to me. He also recommends urine iodine, which is used mainly as a nutritional marker or supplementary to thyroid function testing, though NHS say that iodine deficiency is rarely seen in the general population. But the American Thyroid Association says that approximately 30% of the world's population remain at risk for iodine deficiency. So it's confusing. One can also have a test for, one can also have excess iodine. So we shouldn't assume that low iodine and just start taking iodine salts or something like that without getting tested. This is quite a good website, Stop the Thyroid Madness. And they give comprehensive testing regime and also much more. Right, and on to the last slide. This chap, Brian Walsh, doctor of naturopath, he has two very good videos, all about explaining the thyroid and what a lot of what I put in those diagrams, which I presented. It could be something that healthcare professionals could learn a lot from as well. And lastly, this statement, patients treated with medication should follow up regularly with their doctors to determine whether or not the dose needs to be adjusted based on their thyroid function tests. There's going to be a sweet spot for medications for the individual. It does, from what I've read, seems to be very individual. They can give you medications and you'll still feel like rubbish. So the medications need to be adjusted if you are prescribed that. So let's move like Peppermint Patty from being tired to being happy. Thank you. And I realized that this was probably a bit complicated. So are there any questions?